So neuroradiology is basically where we image the brain and the spine, and we do those things in setting of trauma, but pertinent to Simon Cancer Center when we're evaluating patients that have tumors. What we do is very critical for the oncologists and the other treating physicians to understand how the patient is progressing with their treatment. Is the patient doing well? Is the patient stable? Is the patient doing poorly? And it requires a change in treatment. What we do is very important for patient care and patient outcome. We treat people from all over the world. In fact, we get consults, international consults all the time, both in our adult and pediatric population for, neuro-based tumors. I think WashU is one of the premier medical institutions in the country. So I trained at WashU. I did a 2-year neuroradiology fellowship. So the second year I was a research neuroradiology fellow and junior faculty, and I just fell in love with the place. WashU is a place of excellence, but also a place where values roll around the patient or are focused on the patient. And it's a pleasure to work with people that are so dedicated to the most important cause that we have as physicians, which is, patient care. Not only providing excellent clinical delivery, but also taking the time to interact with the families, to interact with the patients, and form that bond of trust, which is so critical when we're trying to, take care of our patients to help them heal. The technology has moved leaps and bounds in the past 10 years, especially around tumor care with the new immunotherapies and the new chemotherapy agents that we have. As well, with molecular imaging and more precision medicine, we have been able to expand our understanding of imaging of cancers and be more accurate in our imaging, which of course provides more real-time information for the physicians to modify their treatment regimes, be more aggressive or less aggressive as the situation deems. And so I think we have really expanded our, imaging and our care for patients in the past 10 years, where patients are surviving a lot longer. And they also have much better quality of life as the medications are not as toxic as before as well. My grandmother died of glioblastoma, which is one of the reasons I became interested in doing not only neuroradiology, but neuroradiology imaging research, because I know what it does to families, having seen it in my own. So I'm glad to say that we have moved way beyond what it was like for my family when my grandmother passed. With my own research, I do diffusion-weighted imaging of head and neck cancers, and what we're trying to do is expand the availability of this kind of oncologic imaging tools to the entire world, right? So we here are very used to having access to really advanced imaging modalities, PET-CTs, PET-MRs, and that's not the case for other nations, for example. So I think having tools that are more readily accessible to improve our health equity is very important, number one. Number two, with molecular imaging, now looking towards the future, what's coming down the pipeline, we can do even more accurate precision imaging. So for example, we are now using dotatate in meningiomas and esthesioneuroblastomas or other neuroendocrine tumors so that we can catch small amounts of cancer, small amount of metastases very early, and give the patient a much better chance of recuperation and cancer-free survival, as well as better quality of life, so that their disease burden doesn't cause a lot of morbidity or affects their lifestyle. Molecular imaging is very, very exciting. We do have a cyclotron here at WashU, so we're able to produce all these neurotracers or radioimager tracers for cancer imaging, and also on the background work on them in the research arena. So we can symbiotically work with our research physicians, our basic scientists, as well as our clinical researchers in developing and producing these neurotracers. And again, the culture that we have here of excellence in teaching, excellence in clinical work, and excellence in research is really, to me, unmatched in other institutions. And I have worked in California and I have worked in the East Coast. So I speak from experience that what we have here is very special.